All right, today we're diving into something pretty huge. We're talking about a massive healthcare overhaul happening in the Indian state of Himachal Pradesh. And I mean, they're not just making small changes here. They're going for a full-on revolution, and it all kicks off with a really, really big investment.
And it all starts with this number right here. Just look at that, 1,617 crore rupees. That is, wow, we're talking over 16 billion rupees. And get this. This is just the first phase of a project that's designed to completely change the game for public health in the region.
So, this isn't just some line item in a budget. No way. This is the official launch of the Himachal Pradesh Healthcare Modernization Initiative. And it's exactly what it sounds like. A super ambitious plan to build a world-class health system basically from scratch.
And what I think is really key here is the level of commitment this shows. I mean, this wasn't some low-level decision. It was approved by the entire state cabinet, with the chief minister himself leading the meeting. That tells you everything you need to know, right? This has serious political muscle behind it and is a huge priority for the government.
Okay, so we've seen the giant pile of money they're investing, but why? What's the actual goal here? Let's dig into the big vision that's driving all of this.
And there you have it, straight from the chief minister. The goal isn't just to improve things a little bit, it's to make Himachal a model state for healthcare. That's a bold statement, you know? They're basically saying, we want to set the standard that everyone else will look up to.
But what does model state actually mean for the people living there? Well, it means creating a system that covers, well, everything. We're talking from your simple primary checkups all the way to the most advanced specialized surgeries. The whole idea is to make all of it available to every single citizen.
Right. So having an ambitious vision is one thing, but having a solid plan to get there, that's what really matters. So how are they going to pull this off? Let's take a look at the actual blueprint. So the whole strategy is built on four main pillars. You've got model health institutions, beefed up emergency services, really strong specialty services, and a big push for advanced health technology. Let's break down what each of those actually means. First up is infrastructure, and this is a big one. The plan is to establish a high-quality model health institution in every single assembly constituency, all 68 of them. That is a huge deal for access, right? It means that no matter where you are in the state, you're going to have a modern, well-equipped facility not too far away.
Second, there's zeroing in on emergencies, and this is so crucial because we all know that in a crisis, every single second counts. So strengthening these services is all about building a system that can respond fast and effectively when it matters most, literally when lives are on the line.
Third on the list, tackling the travel problem. For way too long, if you lived in a remote area and needed a specialist, you were looking at a journey of hours, sometimes even days. This part of the plan is all about changing that, building a strong network of specialty services inside local communities so that expert care is finally close to home. And the fourth and final pillar? It's all about technology. This really shows the massive shift in thinking. They're moving away from the old way of doing things, relying only on in-person visits and paper records, and instead they're jumping headfirst into things like AI and telemedicine. The goal is to make healthcare way more efficient, modern, and accessible to everyone. Okay, so we've gone through the big vision, the strategy, the four pillars, but let's get down to what really matters. What does any of this mean for the average person just trying to stay healthy in Himachal Pradesh?
Yeah, let's just boil it all down to one simple question. What's the bottom line for the people who live there? If this whole thing works, how will their lives actually change?
And this comparison really spells it out. The whole point is to take on the biggest headaches people have with healthcare right now. We're talking about lowering how much money people have to pay themselves, getting rid of those long, painful trips to see a specialist, and making sure that everyone gets the quality treatment they need right when they need it.
So really, when you cut through all the jargon and the big budget numbers, the ultimate goal is actually super simple and honestly pretty powerful. It's just better health, closer to home, and at a lower cost for everyone. That's it.
And that brings us to a really interesting final question, doesn't it? If they can actually pull this off, if Himachal Pradesh can build this modern, accessible, and affordable healthcare system in some really tough mountainous terrain, you have to wonder, could this plan become a model not just for other states, but maybe for the entire country?